Welcome back to Let's Talk Wellness Now, the show where we uncover the root causes of chronic illness, explore cutting-edge regenerative medicine, and empower you with the tools to heal. I'm Dr. Deb, and today we're diving into the revolutionary world of regenerative medicine and how it's transforming the treatment of chronic conditions. If you or someone you love has been diagnosed with a chronic condition or is struggling with unexplained neurological symptoms like fatigue, brain fog, numbness, or chronic pain, this episode is for you. So grab a cup of coffee, tea, or whatever helps you unwind, settle in, and let's get started on your journey to deeper healing. What if your body already contains everything it needs to heal? In this episode, I'll explore how regenerative medicine is revolutionizing the way we treat chronic illness by harnessing your body's own remarkable healing abilities. If you've been told you'll just have to live with it, or that medication is your only option, this information could change everything for you. The truth is, conventional medicine often focuses on managing symptoms rather than addressing what's actually causing your health problems. But regenerative approaches are different. They aim to repair, restore, and regenerate damaged tissues at the cellular level, targeting the root causes of your own symptoms. Today, I'm going to break down the science behind these groundbreaking therapies, share inspiring patient stories, and offer insights into how these treatments might help when traditional approaches have failed you. You're going to learn in this episode how regenerative medicine differs from conventional symptom management, the science behind cell therapy and who it might help, why platelet-rich plasma, PRP, that's a mouthful, therapy is offering new hope for chronic pain, and the latest research on regenerative approaches for autoimmune conditions, how these therapies might help with previously untreatable conditions, questions to ask your doctor about regenerative options, and so much more. So let's start by understanding what the heck is regenerative medicine anyway. Unlike conventional treatments that often rely on medications to mask symptoms or surgeries that remove damaged tissues, regenerative medicine focuses on actually repairing and restoring function to these damaged tissues and organs. It's exactly what we talk about on this show all the time, finding and addressing that root cause rather than just managing symptoms. And that's precisely what makes regenerative medicine so revolutionary for chronic illness. This field encompasses several innovative therapies, but today I want to focus on two of the most promising approaches: cell therapy, also called stem cell therapy, and platelet-rich plasma treatment, or PRP. First, let's talk about stem cell therapy, or cell therapy. Stem cells are essentially your body's raw materials. They're cells that can transform into many different types of specialized cells, from heart muscle to brain tissue to bone. And when introduced into damaged areas, they can promote, repair, and reduce inflammation and kickstart your body's natural healing processes. What makes this particularly exciting, though, is that in many cases, we can use your own stem cells harvested from bone marrow, adipose tissue, or fat tissue that help reduce the risk of rejection and harness your body's own healing capabilities. We can also use other people's stem cells in the case of umbilical or placental stem cells that come from donated participants to help regenerate your own tissue as well. Dr. Rafael Gonzalez is a leading immunology expert in this field and explains that stem cell therapy can help repair a fatigued immune system, potentially reversing age-related decline and restoring balance after illness or injury. This has profound implications for conditions ranging from autoimmune disease like multiple sclerosis, rheumatoid arthritis, to neurodegenerative diseases like Parkinson's and Alzheimer's disease as well. We're even seeing promising applications in cardiovascular disease, diabetes, and chronic pain conditions. I recently spoke with a patient named Bob who had been living with debilitating rheumatoid arthritis for over a decade. And after trying nearly every conventional treatment with limited success, he underwent stem cell therapy. 6 months after his treatment, he was able to reduce his medications by half. The morning stiffness that used to keep her in bed for hours decreased dramatically. And for the first time in years, he could open jars and button his own shirt without pain. While it wasn't a miracle cure, it gave him quality of life that he looked after forever. His experience isn't unique. Many patients are finding relief where conventional medicine fell short. At the best part, these treatments are typically minimally invasive, often performed on an outpatient basis with relatively little downtime. Now let's talk about PRP, platelet-rich plasma therapy. This treatment uses a concentration of your own platelets, tiny blood cells that play a crucial role in healing, to accelerate the repair of damaged tissues. And here's how it works. A small sample of blood is drawn and placed in a centrifuge, a device that spins your blood, which separates the platelets from the other blood components, kind of just like we do when we take your blood for a normal blood test. But this concentrated solution of platelets is rich in growth factors. It's then injected to an area that needs to repair or heal. PRP has shown remarkable results for joint injuries, arthritis, and soft tissue healing. Athletes have been using this therapy for years to speed recovery, but now it's becoming more accessible to everyone dealing with chronic pain and degenerative conditions. The benefits are compelling. It's minimally invasive, has little risk of rejection since it uses your own blood, and can significantly improve symptoms, sometimes reducing or eliminating the need for surgery or long-term medication. Beyond stem cells and PRP, researchers are developing exciting new approaches, small molecule drugs that can activate the body's own stem cells to repair tissue affected by age-related diseases are showing great promise. These therapies are being developed for conditions like osteoarthritis, inflammatory bowel disease, and even heart failure. Dr. Adil Khan, another pioneer in the field, emphasizes that the combination of stem cells, exosomes, which are tiny vesicles released in the cells that facilitate cell-to-cell communication, and peptides can regenerate damaged tissues, reduce inflammation, and even slow the aging process itself. What excites me most about regenerative medicine is how it's changing our approach to chronic illness, from resignation to hope. By focusing on tissue repair and immune system balance, these therapies aim to modify or even reverse disease progression, not just manage your symptoms. The treatments are personalized to each person's condition and biology. And while they're not a cure-all, many patients experience lasting improvements in pain, function, and quality of life, especially for conditions that previously had limited treatment options. So what does the future hold for regenerative medicine? Clinical trials are currently exploring stem cell therapy for chronic fatigue syndrome, long-haul COVID, and various autoimmune diseases. These researchers are also working to make these treatments more accessible and affordable. As Dr. Khan puts it, we're at the beginning of a new era in medicine, one where we don't just accept chronic illness as inevitable, but actively work to reverse it by harnessing the body's own healing capabilities. If you're someone living with a chronic condition, what should you take away from today's episode? First, regenerative medicine offers genuine hope, not for symptom management, but for actual healing. Second, while these treatments are becoming more mainstream, they're still evolving. It's important to research thoroughly, consult with specialists who have specific training in regenerative medicine, and have realistic expectations. And finally, the field is advancing rapidly. Treatments that seem cutting edge today may be standard care in just a few years. Remember, healing is possible when we address the root cause And regenerative medicine is giving us a powerful new tool to do